for Disease Control now says the threat of COVID-19 has been reduced enough that people in 70% of the country no longer need to wear a mask.
WGN Shannon Halligan joins us now with more on that. Shannon.
Well, these new metrics focus less on positive test results and more on what's happening in hospitals. And that's good news for people in the Chicagoland area.
Many Americans can now take a breath of unmasked air. The Centers for Disease Control and Prevention issued new guidance Friday when it comes to mask wearing.
We continue to see indicators improve in many communities.
Now the CDC is changing the measurements for risk. Instead of focusing on positive test results, Dr. Rochelle Walensky, director of the CDC, said they will assess risk based on communities' new hospitalizations for COVID-19 and hospital bed capacity.
We want to give people a break from things like mask wearing when our levels are low, and then have the ability to reach for them again should things get worse in the future. We at CDC will continue to follow the science and epidemiology to make public health recommendations and guidance based on the data.
Using a color-coded map, each county is designated as orange, yellow, or green. Orange designates places where the CDC suggests masking should remain universal. Yellow indicates people at high risk for severe disease should be cautious. And green means local officials can drop indoor masking rules. That's currently much of northern Illinois. But the CDC still classifies 37% of U.S. counties as high-risk areas, and people with COVID-19 symptoms or who test positive should not stop wearing masks.
Regardless of level, we continue to recommend that people stay up to date on vaccines and get tested if they're sick.
These new recommendations also do not change the requirement to wear masks on public transportation. People will still need to wear masks indoors in airports, train stations, and bus stations. Ben and Micah.
Thank you, Shannon.